Hello everyone, glad to see you here. This is the greeting from Fujian Provincial Hospital. First, please allow me to introduce myself. My name is Wei Tiannan, and I'm from the Department of Hematology in Fujian Provincial Hospital. Today, we're going to learn the chapter Vital Signs from the course of clinical diagnosis. Through the study of this chapter, we will understand the significance of vital signs, and the word vital really means a lot. This is a picture of an ECG monitor, which is very widely used in our daily clinical work, especially in those severely sick patients. From the screen, we can see directly from the top to the bottom, there are the numbers of the test values of the pulse, the blood pressure, and the respiration. These three parameters, plus with body temperature, are the four key roles of vital signs. Please pay attention to the word vital, because it means crucial, it means critical, it means essential, and it means indispensable. From this word, we may get to know how important and how necessary these values are. From this slide, we're going to learn the significance and the meaning of the four vital signs separately: body temperature, pulse, blood pressure, and the respiration. And then we will manage how to identify the values. Body temperature is the most easily identified vital signs of all. In a COVID-19 epidemic recently, the test of body temperature is widely used and very important to the control of the disease. Internal body temperature is tightly regulated to maintain normal cellular function of vital organs, particularly the brain. Deviation of temperature by more than 4 degrees centigrade above or below normal can produce life-threatening cellular dysfunction. Regulation of internal temperature is controlled by the hypothalamus, which maintains a set point for temperature. We must record the patient's temperature at each visit. By doing so, we can establish an individualized baseline for future reference and detect deviations from this baseline, either fever or hypothermia. This is the first step to grasp the situation of the patient. There are many different methods to measure the body temperature of the patient, as it is seen on the slide. In nowadays, mercury-filled glass thermometers have been largely replaced by electronic thermometers, which give rapid, accurate reading when they are well calibrated, as we can see in all the hospitals, airports, railway stations, schools, and so on. After testing the temperature of the patient, it is crucial to remember the normal temperatures in clinical practice. Internal body temperature is maintained within a very narrow range, which is 6.6 degrees centigrade in each individual. However, the population range of this set point varies from 36.0 to 37.5 degrees centigrade, which makes it impossible to know an individual's normal temperature without a prior established baseline. A clinical shortcut for a patient whose normal baseline temperature is unknown is to regard as probably in the febrile range a maximum oral temperature above 37.5 degrees centigrade. We will learn more in the chapter Fever about this. The pulse is the second easily tested vital signs of the four. Palpation of the arterial pulse may be practiced in any of the accessible arteries, as we can see from this slide. To the physician at the bedside, the brachial or radial pulse is usually accessible. We can see here are 6 figures which show the specific position of palpate arteries. In figure A, the temporal artery is anterior to the ear and overlies the temporal bone, one of the few normally tortuous arteries. In emergent situations such as a heart attack or a car crash, the pulse of the patient could be very difficult to find or feel. In such cases, this location is the best way to feel the pulse. And I would like to ask you to look at figure D, which shows the most commonly used test position for the pulse. The radial artery is just medial to the outer border of the radians and lateral to the tendon of the flexor, where the finger can press it against the bone. We usually use the position to feel the pulse and calculate the number of the beat per minute. In sinus rhythm, the impulse originates in the SA node and spreads throughout the walls of the atria, causing their contractions. Then it reaches the AV node. The impulse then follows the 2 branches of the bundle to spread into the 2 ventricles, causing them to contract. This is the beat of the normal heart with a rate between 60 and 100 beats per minute, abbreviated as BPM. Infants and children have higher normal heart rates, and well-conditioned athletes may have resting pulses into the 40s, while deconditioned adults may have rates approaching 100. Therefore, we can't evaluate an individual's condition just according to the heart rates. We must be quite careful about the patient's whole physical status. Generally speaking, heart rates lower than 60 BPM are called bradycardias, and those above 100 BPM are called tachycardias. Blood pressure is also very widely tested in all the population, especially in elderly patients. High blood pressure are commonly seen nowadays, which causes many deaths, strokes, and a great economical loss to the families and the whole society. Therefore, a regular test of blood pressure is very essential to all of us. On the contrary, a low blood pressure, especially a severe low blood pressure, always links to a very dangerous clinical situation, which is called shock. It indicates the patient needs to be cured at once, and it is always the first signal of a critical situation. So, the measurement of blood pressure is very important to the physicians. There are 2 main methods to test the blood pressures: the measurement of arterial blood pressure and the measurement of the brachial artery pressure. Clinically, the indirect method is widely used because it is harmless to the patients. The direct method is practiced only in the intensive care unit when the patient is seriously ill. So today, we only introduce the indirect method to test the blood pressure. The patient may be either sitting or lying in the supine position. In some cases, the pressure may be quite different with changes in posture. The patient should have been resting for at least 30 minutes in a quiet place. Bear the arm and fix the collapsed cuff smoothly, so the distal margin of the cuff is at least 3 cm proximal to the antecubital fossa. Rest the supinated arm on the table or bed with the antecubital fossa approximately at the level of the heart. Palpable for the exact location of the brachial arterial pulse. It is usually medial, but occasionally lateral to the insertion of the biceps tendon. Inflate the cuff to a pressure about 30 mmHg above the point where the palpable pulse disappears. Open the valve slightly so the pressure drops gradually while making observations by auscultation. Vibrations from the artery under pressure are used as pressure indicators. With the veil of the stethoscope pressed lightly over the brachial artery, note the pressure at which sounds first become audible. This reading is taken as the systolic pressure. As deflation proceeds, the sounds become louder and maintain a maximum for a considerable range before becoming muffled. Finally, note the point where the sounds disappear, which could be taken as the diastolic pressure. We will practice this in future class. The calculation of respiration per minute is the last vital sign in clinical use. At rest, the normal respiratory rate in adults is between 12 to 20 cycles per minute. Women have slightly higher rates than men. In alert patients, the respiratory rate should be counted carefully, and there are different types of respiratory during the emergent circumstances. Both extreme fast or slow respiratory rate could be very serious, and we should pay much attention on these abnormal signs. All the situation should be identified prospectively. So after the introduction of the above 4 vital signs and learning their clinical significance and the methods of their measurement, we now all understand how vital they are. In our future study and clinical work, we will get to understand the importance of the measurement further and deeper. Thank you.